to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Daryl Henry
Two statements before we begin.
Has joined the meeting.
I want to note that although
Chaplain
the
John
governor's
Gerhardt
order regarding
Has left the meeting.
quorum via virtual attendance has expired, some of our members are appearing via teleconference today. We do, however, have a quorum on hand, and you can see that we are seated to accommodate the
This
state
thing's only got so much volume.
regarding social distancing related to the current public health emergency. We are also continuing to streamline our meetings process to avoid non-essential items from our consideration. And the other notice is any citizen desiring
Doesn't have enough.
to address the hospital board.
I know it. This is how it's just going to go. There's not enough.
Daryl, can you mute your phone, please? Should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other person seeking hospital contracts or work on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, legal counsel, to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate the claims at this meeting. Okay, number one item, the approval of the orders of the day. I ask for a motion to approve the orders of the day.
Second.
All those in favor respond by saying yes.
Yes.
Opposed, the motion carries. Seek approval of the minutes of the meeting of November 17, 2020. Ask for a motion, please.
Motion.
Have a second?
Second.
All those in favor respond by saying yes.
Yes.
Opposed, is carried. Board reports. First off is the report of the medical staff, Dr. Jack Foss. Please.
Thank you, Mr. Meister. We have a large number of items for which we need board approval this month, including the establishing resolution for the SMH Venice Hospital medical staff. I understand you all received large documents that have been discussed and approved by the Physician Advisory Council, and I'm happy to answer any questions about them. And I think Mrs. Wessler DePeters has the either questions or the motion for approval.
Thank you, Dr. Watson. I move approval of the following medical staff governance documents: the Joint Credentials Policy, Glossary, Medical Staff Bylaws, and Organizational Manual. The Department Rules for the Cardiology, Emergency Medicine, Pathology, Pediatric, Psychiatry, Psychology, and Surgery departments, and the privileging forms for the various specialty physicians and advanced practice professionals as published, and the clinical contracts as published, all as recommended by the Medical Executive Committee. Now I will ask Carol Ann to read the resolution regarding Venice Hospital.
So let's do the motion on the first one, and somehow I think there was a translational error, so the total
documents, the governance documents that are being approved is the joint credentials policy, the glossary, the medical staff bylaws, the org manual, and the medical staff rules and regulations. And then everything else was as read up through item D. So let's have a motion for that, and then we'll do the resolution.
So moved. All those in favor respond by saying yes.
Yes.
Opposed? Motion carries. Continue, please.
At
Now
your request, I'll read the
Yes,
resolution.
now I have, I'll ask Caroline to read the resolution.
So, this is a resolution that is gonna establish the medical staff and give it power to act, and give this board the power to act before the hospital actually exists and before there's a medical staff. So, it's a resolution by the Sarasota County Public Hospital Board to adopt the medical staff bylaws and related policies and forms. Whereas necessary steps are underway to facilitate the opening of Sarasota Memorial Hospital Venice, otherwise known as SMH Venice, which is expected to take place in the fall of 2021. And whereas a physician advisory committee has been appointed to assist with the organization of the new medical staff at SMH Venice. And whereas as part of these duties, the physician advisory committee has reviewed and recommended medical staff bylaws and other policies for the future SMH Venice medical staff. And whereas in order for SMH Venice to be ready to begin admitting and treating patients in the fall of 2021, it is also necessary to develop application forms for appointment and clinical privileges to the medical staff and for advanced practice professionals, as well as delineation of privilege forms, including core and additional privileges by specialty and the criteria for such. Now therefore be it resolved that the following documents are approved and adopted to serve as the governing documents of SMH Venice's medical staff bylaws, SMH Joint Medical Staff Credentials Policy and Glossary, Organizational Manual, Medical Staff Rules and Regulations, and Privilege Request Forms. Be it further resolved that notwithstanding the amendment process in any of the above documents, until the fall of 2021, or until such time as SMH Venice is ready to begin admitting and treating patients, whichever comes later, the board will have the authority to amend these documents upon review of any such proposed amendment by the Physician Advisory Committee. Be it further resolved that the attached applications, and these are applications that you all had access to, for appointment and clinical privileges to the medical staff and for advanced practice professionals are adopted. And if so moved, this will be adopted as of today's date.
I have a second.
No, I think I move to adopt the resolution.
Second. All those in favor respond by saying yes.
Yes.
Opposed? Motion carries.
And that is the end of the report.
Thank you very much. Next up is the orders of the day.
Secretary.
I'm sorry. Thank you.
That's okay. Our next board meeting will be Tuesday, January 19th, 2021. Please note that board meetings are held on the third Monday of the month except for MLK Junior Day and President's Day when the meetings are held on the following day. From 9 to 10:30 a.m. we will have the Joint Finance and Audit Committee. From 10:30 to noon we will have Quality Committee. From noon to 12:30 we will have the closed session hospital board meeting. From 12:30 to 2 we will have the financial review, board report, and lunch. And then from 2 to 4 the board meeting.
Thank you very much. Treasurer's report, Mr. DiVirginio, please.
Thank you, Mr. Chairman. I have one motion. I move approval of bad debt and charity care for the month ending November 30th, 2020 in the amount of $18,399,000.
You have a second?
Sorry.
All those in favor, respond by saying yes.
Yes.
Opposed? Motion carries. Bill Baldwin, our Chief Financial Officer, will give us the financial highlights. Bill?
Thank you. I have the highlights for November, and we'll start with total revenue for the system. One second. In rating agency format, so for November, we had revenue of $86,278,000 compared to a budget of $86,543,000. For the fiscal year to date, revenue of $175,629,000 compared to a budget of $175,520,000. Go. For the system's total expenses in the rating agency format for November, $81,253,000 compared to a budget of $81,633,000. For the 2 months of the fiscal year, total expenses of $165,446,000 compared to a budget of $165,703,000. For operating income for the system in the rating agency format, $5,025,000, which was an operating margin of 5.8% compared to a budget of $4,910,000, which was a budgeted operating margin of 5.7%. For the 2 months of the fiscal year, we had the operating income of $10,183,000, operating margin of 5.8%, compared to a budget of $9,817,000, budgeted operating margin of 5.6%. Moving on to hospital statistics, and these are for 2 months of the fiscal year. Average daily occupancy, 603 patients per day compared to a budget of 550. The average acute length of stay this year, fiscal year, 4.67 compared to last year, 4.15. So far this fiscal year, we've had 6,945 admissions compared to a budget of 7,295. Continuing with statistics, surgery cases for the 2 months, 3,697 compared to a budget of 4,050. And so far we've had 579 births compared to a budget of 667. The outpatient registrations total 72,817 compared to a budget of 79,478. And between the two emergency care centers, we've had registrations of 17,191 compared to a budget of 20,266. And through 2 months of the fiscal year, our case mix index for all patients 1.86, and for Medicare patients 2.01. Mr. Chairman, that concludes my report unless there's any questions.
Any questions? Thank you, Bill. Up next, committee reports, governance, effectiveness committee, Chairman. So you're up.
Thank you, Mr. Chairman. At the Governance Effectiveness Committee meeting this morning, we discussed board committee chairs and assignments. Based on that discussion, I have a motion. I move approval of the board committee leadership, community membership, and physician membership as appointed by Mr. Meister as the board chair.
You have a second? Second. All those in favor respond by saying yes.
There
Yes.
should be discussion, please. I stated again, there should be discussion on the motion, please.
Jim? Go ahead.
Go ahead. You can
Go ahead, Tram.
I would like to discuss this motion. Earlier, I had expressed disappointment and also objection that the chairman has decided to replace me as chairman of the audit committee. I believe that this was an effort to try to silence me in terms of speaking out on items that I believe are irregular in the operation of the hospital, specifically the doctor's garden matter. I have suggested that by naming Sarah Lodge as the chairman of the audit committee, that she was probably better suited for the investment committee where you have placed me. And I again express my objection to being removed as audit committee chairman and view this as an effort to silence any independent management of that committee. I will vote no against the motion.
Thank you. So all those in favor respond again by saying yes.
Yes.
Opposed?
No.
The motion carries.
Let me continue, Jim. Thank you. As part of the board's annual review process for the president and CEO, the committee then heard from Mr. Veringer, who reported on the year that the system has had. Sarasota Memorial continues to be a leader in clinical and other areas, including the use of information technology. In the midst of the unprecedented global pandemic, during which Sarasota Memorial participated in groundbreaking clinical trials to advance the treatment of COVID-19, Sarasota Memorial kept its patients and staff safe and the community informed. As we start the vaccines this week, in what is hoped the beginning of the end of this challenge, it is especially laudable that during this year, the system continued to sustain the financial performance necessary to ensure that we stand ready to serve the community through this year and into the future, including the opening of our new hospital in Venice and the cancer tower right here on this campus. The board recommends Mr. Veringer and myself as committee chair and individual on the board, I do so also, for his leadership and the entire SMH team for all it has done and continues to do to serve its patients and the community and in response to this pandemic that is really overtaking everyone. As a result of that and that discussion relative to Mr. Veringer's compensation, at this time, I move approval of a merit increase on base salary for Mr. Veringer as discussed and pursuant to the system's leadership performance appraisal policy as recommended by the Governance Effectiveness Committee.
Please have a second.
Second.
All those in favor?
Discussion, please. Discussion.
Go ahead, Mr. Trent.
I would like, for the record, to know the exact amount that this increase will be, please.
Hold on one second.
It's 7.7% to $1,125,000.
Say that again. Say that again, please.
7.7% increase.
To $1,125,000.
$1,125,000 as an ultimate salary.
Thank you.
That's base.
So we have the motion on the table. Second. All those in favor respond by saying yes.
Yes.
Opposed?
No.
Motion carries. Up next is.
One more item. The board further discussed Mr. Veringer's employment agreement. There was significant discussion regarding the relative merit of a long versus short-term agreements. At this time, I move approval of an extension to Mr. Veringer's agreement from the current remaining 2 years to 10 years, subject to details being confirmed by the board at a later meeting as recommended by the Governance Effectiveness Committee.
Second.
All those in favor?
Discussion, please.
Go ahead, Mr. Hudson.
For the record, I'd like to point out that this is a material change to the contract. A 10-year contract extension for a government employee, I think, is inappropriate for an elected body to extend to the CEO. Furthermore, this was not noticed in the public records that this motion would be voted on. In the meeting, I had proposed that we table this so that the Mr. DiVirgilio or Mr. Meister could come back to the board with a recommendation. Some of the board members have never read his contract. I think this is a dereliction of duty for the board to vote on a 10-year contract extension without having read it and had it noticed and discussed in a public form. Therefore, I will vote no against this motion.
Thank you, Mr. Hudson. So we'll rerun the vote. All those in favor respond by saying yes.
Yes.
Opposed? Motion carries.
Could you have the secretary read the roll call vote, please, for the record? I vote no.
Mr. Chairman, I have a question. If the governor says that you must be at the meeting to vote, does the governor say that you have to be at the meeting to have your opinions in the minutes?
I'm not
Seems to
sure
me
what the governor says.
one follows the other.
I don't believe so. Is this another effort to silence independent questioning by a complicit board?
Can I suggest that if there's some dirty laundry to be washed out, we do it at our next board meeting? Is that okay? Thank you.
Anyway, Tran did that for a roll call vote. And Tran, everyone voted in favor with the exception of yourself. We have one no vote and the rest
And
are.
that to be reflected and the reason for my no vote in the minutes. Thank you.
That is all from the government.
Thank you, Joe. Appreciate it. Can we proceed, please? Next up is the President's report. Our CEO and President, David Barrington.
Thank you, Mr. Meister. I would just take a moment and thank the board for your confidence and I very much appreciate my review and recognizing what the entire team has done for the community and for this healthcare system. Appreciate it very much. Bill, you going to drive this one? Okay. So I'm going to start, as we do in every month, on our organizational report card. The first line item is service, and it's the system patient experience, the likelihood of recommending the number of services areas greater than or equal to the 75th percentile. We have a goal of having 8 out of the 10. We did slip a little bit in this month, and we are at 7 out of 10, and I'll show you that detail here in a minute. Under the people pillar, we have our goal is having new hire retention percentage of regular full-time, part-time employees hired in FY 2021 that are still employed as of September 30th, 2021. We have a goal of having 83%. I'm happy to report we are exceeding that, and we're at 87.95%. In quality, we have infection prevention, our combined overall standardized infection rate. We have a goal of being less than 0.88. And we are exceeding that as well at 0.76. Just to remind the board that the national average or the expected is a 1.0, so we are doing quite a bit better than others in the field. In the finance area, as you heard from our CFO, Bill Wojcik, talk about our organizational finance, our operating margins is the goal of 5.5%. We are projecting that we're going to hit 5.5%, so meeting the goal. In the growth area, we have two goals, one being inpatient admissions and observation outpatients. We have a goal of being at 51,164. We are tracking less than that at 47,950. And our outpatient registrations having a goal of 977,000, and we're tracking less than that as well at 898,000. So looking at a little bit more detail on the likelihood of recommending, you do see the 10 different areas that we survey on the left-hand side. The next column is what our actual score is. The third column is the national median score, and then finally the far right is the 75th percentile score, which is what we base our goals off of. We did have 3 different areas not meet the 75th percentile, both the ER in Northport and on the main campus, as well as First Physicians Group. Obviously, these are very tight scores, and it's been a very trying time in the ER, specifically, and throughout the organization, but specifically the ER, just with the COVID situation. So I know our teams are very focused on this and continue to work on it. Next up is a celebration of SMH is among America's 50 best heart hospitals. Watson Health recently named Sarasota Memorial among its 50 top cardiovascular hospital list. We were the only Suncoast hospital to make the 2021 list, which is based on quality indicators and outcomes. Compared to similar cardiovascular hospitals, this year's top 50 hospital winners demonstrate better survival rates, fewer patient complications, fewer healthcare associated infections, lower 30-day mortality and readmission rates, shorter length of stay, lower inpatient expenses. This is the second award Watson Health has given to SMH this year. In June, the national organization named SMH a top 100 hospital for overall quality and safety. SMH participates in experimental antibody treatments for COVID-19. Sarasota Memorial was among a number of hospitals that have been allocated a very limited supply of monoclonal antibody therapy for non-hospitalized patients who have been diagnosed with mild to moderate case of COVID-19 within the past 10 days and have a high risk for severe disease or hospitalization. Eli Lilly and Company and Regeneron's antibody treatments recently received emergency use authorization from the U.S. Food and Drug Administration. SMH has developed distribution protocols and a screening process based on FDA criteria to ensure the drug's limited supplies are provided to those high-risk outpatients who can obtain the greatest benefit. To be considered for treatment, patients must be referred to by a physician, be 18 years old or older, and meet criteria established by the FDA. SMH staff has spread holiday cheer, and again this year, employees, retirees, family members, and friends from across the healthcare system showed their holiday spirit by generously supporting Children First, Adopt a Family. We had 19 families adopted. Senior Friendship Center and Seniors in Need, 12 SMH teams participated in this. Mothers Helping Mothers, Holiday Toy Drive, 5 SMH teams participated. Just many thanks to their commitment to our community, and you know, of course, they all are wishing everyone a happy holidays. Next is our partnerships, bring more PCTs on board. Thanks to an innovative partnership with Suncoast Technical College and funding from Career Edge, Sarasota Memorial has been able to train and hire dozens of new patient care technicians over the past 2 years. To date, more than 70 students have gone through the training program, and the sixth cohort recently ended. Many of the participants previously worked in support departments at SMH, but were interested in transitioning to a clinical role, and now they are on nursing teams throughout the hospital. Congratulations to all of our PCTs. Construction progress on SMH Venice. You can see 4 different pictures up there. We're making a lot of progress there. Our president of our Venice Hospital, Sharon, is obviously in the room today. And really, Sharon, you guys are doing a fantastic job, and has promised us that we're on track for completion of our fall 2021. So looking forward to seeing it. We also have construction progress on our Oncology tower. The exterior glass installation is in progress. Interior and exterior framing and sheathing is going on every floor. Level 3 ceramic tile installation is in progress. Level 6 and 7 wall framing is underway. Mechanical, electrical, and plumbing work is taking place on all levels. Roofing also in progress and on track to open fall 2021. Lori Lang, our president of SMH main campus, is overseeing this project, and Lori also assures me this is going to be ready in October 21. Thank you, Lori. And thank you to everyone who continues to support and be interested in Sarasota Memorial and our hospital and healthcare system. We want, on behalf of the board, on behalf of our employees and our management, we just want to wish everyone a happy holidays. Thank you.
Thank you, David. Karen, do we have anyone that signed up to comment?
No, sir, we did not.
Legal matters, Carol Ann?
I have no report.
Having completed our agenda?
No, Mr. Chairman,
Sorry.
I was really serious when I asked that before. I know Mr. Hudson feels that we're trying to shut him up. That is not my purpose at all. I wish he would come to the meetings. But what I'm asking is a clarification as to what people, since the governor, who I assume has the authority over public institutions, since he has already said that if you don't come to the meeting, you aren't part of it, I'm asking that we delineate what can be done other than just interrupting when they feel like it, which is very, very, very distressing, but making motions and voting when I suspect they aren't legal. And so if we are allowing that, are we doing what's illegal relative to the governor? In spite of what Mr. Hudson says about my opinion, the fact that what we're doing, allowing them to make motions and vote, is not what the governor intended when he said you must come to the meeting to be involved with it. If we want to pass it to them
Mr. Chairman,
as a courtesy, that's fine. If we want to broadcast it as a courtesy, that's fine. But to allow them to interrupt, 50 times in a meeting and do all the vote, et cetera, I really would like it looked into and defined.
So let's turn to our chief legal officer.
Thank you very much. Dr. Raymeyer, thank you for the question. As I think I mentioned last time when we were discussing, in our last board meeting, when we were discussing the expiration of the governor's order, it is clear that folks who are not attending in person cannot be used to establish a quorum. It is less clear whether or not folks who are not attending in person are able to fully participate in the meeting. If you'd like me to seek clarification of that from the Attorney General, I can do that. The only line of current opinions on that have to do with people who are physically unable to attend because of disabilities. But I'm happy to seek clarification on the parameters in light of the pandemic and in light of the governor's order regarding establishment of the quorum expiring.
Well, I would ask you to do that, but it's the chairman's position to decide whether it's done or not.
If you would like me to do that, I'm happy to do that.
Please. Okay. Any other business? We stand adjourned. Happy holiday to everyone.
Sometimes enough is enough.
Dave.